Hi, this is Steve Israel. It's Saturday, and we are coming close to a vote, a very important vote on health care in the United States Congress. I'm voting yes for two reasons. Number one, the cost of health care is just becoming out of reach for too many Long Islanders and Long Island businesses. If you're a Long Island family, you have seen your health care costs double in the past 8 to 10 years. If you're a Long Island business, you are receiving double-digit premium increases. I have been traveling throughout our congressional district, talking to those families, talking to those businesses. Families are telling me they're finding it harder and harder to budget for health care. And businesses are telling me that their premiums are increasing so fast that they're being forced to make decisions to trim their payrolls or reduce raises. And some are even considering for the very first time terminating health insurance coverage for their employees. That's not acceptable. The second reason that I'm voting for this bill is that once and for all we have to end the insurance company practice of denying people treatment despite the fact that they've paid their premiums. Denying people coverage based on pre-existing condition, or the sticker shock that you get when you open up that envelope, that statement of services, and learn that your insurance company just isn't going to pay for what you thought they would pay for. Those are the two reasons that bring me to this vote. Now, the original bill did present some concerns and some challenges, particularly for middle-class families on Long Island. And I'm happy to report to you that I was able to fight to address those concerns based on the feedback that you provided at the many town hall meetings I had on this, and the public forums, and the town hall conference calls that we've had, and my visits to your businesses and to your homes. Let me give you two in particular. One of the major concerns I had is that the original bill funds health insurance reform with a so-called surtax on a portion of earnings. I was able to increase the trigger for that surtax to $1 million in family income. So if you are earning less than $1 million in your family, you will not be subject to any surtax to fund this bill. If you're making over $1 million in family income, you will. The second major improvement that I was able to make was with respect to the so-called donut hole for seniors who are in Medicare Advantage plans. Many seniors said that that donut hole is unfair. They want it closed faster, and they want it closed more dramatically. And so starting in 2010, we're going to begin to close that donut hole with an immediate $500 provision. You will receive a $500 credit so that you don't have to pay high costs for prescription drugs. Those are just two improvements. There are many others, including the right of insurance companies to sell across state lines. That's something that many of you believed in, and that's been worked into the final product. Ultimately, I agree with the doctors at the American Medical Association, the nurses at the American Nurses Association, the volunteers with the American Cancer Society, the people with Consumers Union, and so many other organizations that we need to contain costs for health care because it's breaking our family budgets and breaking our business budgets, and we also have to protect consumers who've been exposed to those insurance company abuses. Is this a perfect bill? No. Nothing in government is perfect, and I'm going to continue to fight for a more competent government that delivers real results. But this is an important turning point in the healthcare debate. It's an important turning point in making sure that you can afford health care, that it is accessible, and that you're protected from abuses by health insurance companies. The bill now, once it passes, will go to the Senate. The Senate is likely to make additional changes, and I will continue to listen carefully to what you say and attempt to inject your thoughts and your opinions into the debate towards a final product that is a product of consensus. Thank you.